The following programme, produced and funded by MyFaceMyBody, is also partly funded by EndyMed Pro, Glow Minerals, Zoom and iGuide.
Welcome to My Face, My Body, the show that aims to answer all your health and beauty questions. In this series, we'll be travelling the length and breadth of the UK, answering all the questions your body needs to hear. So, is beauty really skin deep? Well, I'm here back on the catwalk at Britain and Ireland's Next Top Model to give you those answers. However, you're going to have to find out a little bit later on the show. Coming up, we'll be looking at the best Christmas gifts you can give to your loved ones. Does symmetry equal beauty? And we look into teeth whitening products from the high street and how effective they really are. Well, we're heading into the Christmas season, and I'm here with Jackie from Dermal Clinic in the heart of Edinburgh, and we're quite keen to find out what are some of the popular treatments people are having before, I suppose, the big Christmas break, or giving as gifts to their loved ones.
Well, we've got gift packs, first of all, where people can literally be buying creams and, you know, nice sort of hamper ideas for loved ones. But if you're not quite sure, there's always the option of Dermal Clinic vouchers. So rather than a husband, for example, going home and say, that's for Botox, darling, and getting a slap round the head, it does mean that literally they can use those vouchers for anything they want. So we've got the laser hair removal with the Soprano, for example, which is pain-free, and it could be the derma roller, skin peels, Botox fillers, you name it.
Tell us a little bit more about the Soprano, because I mean that's laser hair removal. I mean that's quite a popular treatment, but it'd be really great for a Christmas gift.
Yeah, absolutely, absolutely. Ladies are not wanting hairy legs, men are not wanting hairy backs, so it really is something that can be used for either male or female. Waxing has obviously been the main sort of hair removal product of choice up until now, and what people are not wanting is ingrown hairs. They're not wanting the pain associated with hair removal. So that's why we decided to go down the route of taking on the Soprano laser.
Is it really pain-free?
It is pain-free.
Okay.
It really is. It feels like a hot stone massage. It's lovely.
The laser hair removal is great for the younger generation, but also more of a mature consumer. But I know you mentioned about these volumization treatments, probably better even for the more mature.
Absolutely. The way that the face actually ages is it's not so much about chasing lines and individual wrinkles these days. In aesthetics, we've all really realised that a big factor is loss of volume in the face, and it does tend to be in the top third and the mid-face. So what we do now is we actually use a deeper product. It's called Juvederm Voluma, and that goes very, very deep down and lifts and re-enhances the face to give you back your natural shape and the volume. So for things like cheeks, temple areas, and even the jawline and chin.
So if someone is on a budget, are there options out there for them?
There really is something for everybody, and what we do when a client comes in to see us at Dermal Clinic is we don't just look at an individual problem. We don't say, I take it you've come in because of that line between your eyebrows, for example. It's very much what's important to the patient. We then take the patient through a whole treatment program to sort of say, these are the options, these are the things we could do, this is how we could relax muscles, this is how we can volumize cheeks, all the different aspects that would be available, and then put together an individual custom treatment plan for them. And therefore we can literally target every single person depending on their budget.
Great. So if you're around the Scotland area and you want to buy a great Christmas gift or a voucher, come and see Jackie at the Dermal Clinic.
My name is Antonia Mariconda. I'm the skincare expert for My Face, My Body. Now currently there are hundreds of products on the skincare market, but a question I often get asked is, how do I know which one is right for me? Today I'm going to be showing you how to find the right ingredients for the right product for you. Now, one of the most talked about products in anti-aging and skincare is retinol. Retinol is a fabulous ingredient to find in any skincare product. For example, retinol will strengthen the collagen layers and give your skin back that elasticity that it loses with time and with age. One important tip is when you are looking for retinol-based products, don't forget to wear sunscreen, as retinol does sensitize your skin. Look on the box, check retinol is on there. For example, this is a classic example of a retinol-based product, but you can find a brilliant array. Just make sure you wear your sunscreen. Now, everybody loves plants and flowers, and we all know that they make our houses look extremely beautiful, but did you know that they are also an essential part of skincare? Many big brands have now cottoned on to the fact that natural plant extracts, such as eucalyptus, rose petals and green tea, and red sarnsbury, also known as sleeping morning, are absolutely essential in skincare. Not only do they smooth out the skin, hydrate the skin, but they're also powerful natural anti-agers. So look for products in your skincare that contain plant extracts. Now, one of my favourite key ingredients in skincare is hyaluronic acid. Naturally found in our own bodies, hyaluronic acid is what gives our skin elasticity, radiance and smoothness. With time and with age, obviously, that can diminish. If you are looking for a product to give you great anti-aging properties and those essential ingredients that will make a difference, hyaluronic acid has to be the one for you.
What is laser dentistry, and what sort of applications is it for? Is it for whitening, or is it for other things as well?
Okay, so there are a variety of lasers available, and we have a variety of lasers that do different things. So it's not just having one laser machine to do the odd treatment. So we have 3 or 4 different types of laser machines available. And with that, you can either whiten teeth, you can reshape the gums, so you can actually improve the gums, enhance them, so the smile looks better without doing any other dentistry. We can do drill-free, pain-free, needle-free dentistry on our patients, especially young children, so we actually get them to experience comfortable dentistry.
That is the one big thing I think that scares a lot of people off going to the dentist, isn't it? Is the pain,
Absolutely.
the drilling noise. But this sounds like it's a good solution to people that are scared of the dentist.
Yes. And how many times do you have people say to you they've had wisdom teeth problems?
Yes.
And often they say they need to have the wisdom teeth removed.
Yeah.
Well, there are certain treatments available with a laser where you can actually make them so much more comfortable, and then you don't often have to take those teeth out.
Do many practices around the country offer laser technology treatments, or is it something quite particular to your clinic?
The actual laser machine itself does vary, and they are quite expensive machines. So it depends on how many practices actually go and invest in all the variety of lasers available.
Yeah.
So lasers have been around for a while, but most practices have either one or the other, but not the entire group of lasers that are available.
Hi, my name is Wendy Campbell, makeup artist for Colour Directions. Today I'm going to show you a makeup look for Christmas. 9 out of 10 of us wear the little black dress, so I want to add a little bit of colour but show you a really easy way to do it. So the first thing we're going to use Photo Touch foundation. So with the brush, we just apply it all over the skin. What this does for tired or dull or dry skin, it makes it bright, it makes it flawless. So even if you've had a few late nights, your skin is still going to look great. And the next product we're going to use is a mineral powder. And what it does, it absorbs excess oil. So the great thing with this product is, if you're dancing the night away, and you do get very hot, it's going to stop the skin from shining and it's going to keep your skin matte. You just pat it onto the skin and you can see instantly it just gives that more flawless and more professional finish. Sometimes when you see these eyeshadow sets you think, oh my gosh, where would I put that bright green? Well, I'm going to show you. We're going to use the light mint green first all over the eye area. Now in these eyeshadow sets you get 4 colours. It doesn't necessarily mean you have to use 4 colours. And what we do, we get the bright green on the little brush, putting it all over the lid of the eye, just above the lashes. So exactly where a liquid liner would go. But when you're using it with a little brush, you're a lot more in control and we can keep on going to go as bright as we want. So you're in complete control of it. And then I'm going to get the bright green again, and I'm going to go underneath her eye. Monique's got beautiful green eyes, so this is going to make her eyes so much brighter than just natural browns would. So if you had blue eyes, you could do the same with the bright blue colour correction palette. If you have brown eyes, then the purple colour correction Rock Diva would look fantastic. And now we're just going to finish the look off with a really nice gold gloss that's something very, very sparkly, and she's ready to go and party. This programme, produced and funded by MyFaceMyBody, is also partly funded by EndyMed Pro, Glow Minerals, Zoom and iGuide.
Here at London Bridge Plastic Surgery, we've been using the genuine derma roller for about 2 years. Derma roller is actually suitable for anyone. It can be used on all skin types. We can use the treatment on the face, on the neck, the décolletage, anywhere on the body and the hands.
The derma roller is fantastic for rejuvenating the skin and improving elasticity of the skin or surrounding areas, particularly with acne scars. It will reduce the indentation of the scar and make them much more shallow. And we start with numbing the area and then using a handheld roller to treat in the area, which creates a mild medical trauma, which in turn stimulates the fibroblast cells and has a knock-on effect with the collagen. The skin will feel warm and look red or pink, which will subside quite quickly, 1 to 2 days back to normal.
Women are perhaps worried about having any sort of toxins or any products put into their body, and that's the good thing about the derma roller is there isn't anything going in. It's literally stimulating your own collagen. For any woman who's out there who's just gone through pregnancy or who's just, you know, obviously had a baby and there are parts of their bodies which aren't quite like they used to be, then certainly the derma roller is something for them to consider.
I'm here in Bury St Edmunds in the heart of West Suffolk. Now I'm with our resident dentist, Dr. Indy Singh from Cathedral Dental, and we're going to be talking about the link between symmetry and beauty. But I suppose the big question is where are we? This is an interesting dental practice.
Yeah, as you rightly said there, Steve, there is a big link between symmetry and beauty, whether it's clothing, whether it's your face, and especially when it comes to teeth, symmetry is very important. And I brought you here because I feel it illustrates it perfectly. We're in the Abbey Gardens, which is a stone's throw from the practice, and we've got the ruins of the original Bury St Edmunds Abbey, and as you can see, there isn't a great deal of symmetry between all these ruins. Even though it does have a certain charm, you wouldn't really say it's beautiful.
Yeah.
Whereas if you compare it to the new cathedral, which you can see directly behind us there, you can see the perfect symmetry between the windows and all the steeple there, and I think it just looks fantastic. And, you know, I suppose you could say it's beautiful.
Yeah, I mean, these little pieces look like teeth, funny enough.
Yeah, they do, yeah. Not very nice looking teeth, but as you said, I suppose they do look a bit like teeth.
So what's the link between symmetry and cosmetic dentistry?
You want perfect symmetry between all of the teeth, and that is what gives you the perfect smile. It's one of the fundamental parts of it. People do tend to come to me concerned about the appearance of the teeth, and a lot of it is related to symmetry, even though they don't know it. That what they're telling you about certain teeth which are in a certain place is no symmetry there, and that's what we strive to create when you try and create our smiles.
So sometimes just a little adjustment with the teeth can make quite a big difference.
There's a lot of treatments we can do to improve things. It doesn't have to be your full-on smile makeover. Often it can be the simplest things you can do. For example, I had a patient a few days ago whose front teeth were a slightly different length. I did a little bit of polishing on those teeth to make them even. It only took about 5 or 10 minutes, and it created a fantastic cosmetic result. But on the flip side, you know, some people do need to have a lot more treatment. They have crowded, crooked teeth. And we need to use like one of the cosmetic brace systems like Invisalign, 6-month smiles, or the Inman aligner. They all work really well at creating the symmetry. And some people's teeth which are broken down or worn or discoloured, you know, we can do the full smile makeover with the veneers and crowns, and at the same time, it's the same fundamental goal. We're looking to create symmetry to give them that smile they want.
I think you've really given us a great insight into, you know, how the link between symmetry and obviously beauty in terms of cosmetic dentistry. So I appreciate it. Thank you very much.
Okay, thanks.
Excellent.
In some areas of the body, symmetry is very important. For example, in the eyes, it's very important to have good symmetry, or in the nose, or the breasts. However, some degree of asymmetry adds an attractiveness, almost an intrigue level to that particular face. And that's why the majority of Hollywood movie stars have done very well with less than perfect faces. The trend is a much more natural enhancement of the breast. There are very small numbers of patients who want extremely large implants. There's an equally small number of patients who want very small implants, and the majority are somewhere in the middle. There is a lot of art involved because it's very much a judgmental of aesthetics and what looks good, but there is a lot of science in it because the selection of the right size, shape, position of implant very much is determined by the particular anatomy of that particular patient. The whole treatment of a patient with breast cancer is not just about the cancer, it's about restoring the whole patient to feeling confident, feeling positive about their future life. Because we must look that our goal is not just to get rid of the cancer, but to give that patient back their quality of life.
Well, I'm here today with Gary, who's our patient, who's going to be having the vasolipo procedure on his chin. Now, Gary's going to give us his personal updates all day.
Yeah.
So I think it's all up to you, mate.
Okay.
Good stuff.
You're not coming with me? Just about to meet Dr. Berkowitz for my vasoliposuction on my chin. It's been a long while I've been looking into this procedure, and I saw Dr. Berkowitz on the MyFaceMyBody website. I'd had a look around at a lot of different doctors and a lot of different centres around London and pretty much all over the country to find the right place to do this, and certainly very happy with what I saw when I first met Dr. Berkowitz for my consultation. He assured me that everything will be fine, and everything I've seen really backs up what he said. So a little bit nervous about the day. Obviously with any procedure it's going to be a little bit scary, but I'm feeling very happy and looking forward to it being done and seeing the results.
My name's Josh Berkowitz, and this morning I'm going to perform a liposelection procedure on my patient using a VASA ultrasound probe. The probe will selectively destroy the fat tissue in his chin, which is the area we've selected to do, and subsequent to that destruction we'll be able to suck out some of that fat. The procedure is performed completely under local anesthetic. It's an excellent procedure because it is quick and because it is safe and because it is exceptionally effective. Generally the recovery is quick, and you can usually see the results within about a week, but the final result may take as long as 3 months.
Hi, yes, so that's the procedure all done. I've got these dressings on overnight that make me look quite strange, but this speeds up the healing process, so yeah, much quicker and easier than I thought.
Hi, so here I am 6 weeks later after the surgery, living in beautiful New Zealand. The healing went really well. I've got those big bandages off that were really not too bad. I only had to have them on for a day or two. So much better result than I expected. When I put my chin back, I don't have that huge fold of skin that I had before, and much happy to see myself in photographs. It's given me a newfound confidence, and especially with meeting new people here, I feel like I've got a new start.
Linda, we went to the high street. We've bought loads of products. I think it's quite confusing for a lot of consumers, you know, what products to buy. But, you know, what I've heard is going to the dentist is a lot better. But can you tell us, you know, the options in terms of whitening at the dentist?
Well, basically there's different types of whitening. There's different cases. Everybody's teeth are different. So not everybody will respond to whitening in the same way. And so the dentist needs to diagnose what the problem is in the first place. Some people have a basic problem, some people have very advanced problems, and these products on the high street will not make a difference. You need to go to a dentist to monitor the whole process and to make sure everything runs smoothly.
So, okay. Well, I'd love to see some case studies.
Sure, we'll show you. This particular person has basic bleaching case because she's got beautiful, healthy teeth. The teeth are just a little bit yellow from the foods that she was eating. And what we did for her, we did whitening with using bleaching trays that we made specially for her. And she wore them first for the upper, and we got a beautiful result, and then we continued with the lower. And she's remained at that beautiful white colour for the last 5 years by using the specific protocols that we recommend in the surgery for her.
So what about a more severe case?
A more severe case would be somebody like this, where she has brown and white staining, and which were embedded in the enamel as the tooth was forming. As you see, the teeth are very orange. The brown, orange and white comes out during the whitening process, and then there's still some small little white spots, and those are polished with microabrasion. Well, I'll just show you the final result on her. You see she's got a beautiful,
wow,
look how glossy the teeth are, and they're beautifully even and white.
If people have actually had teeth whitening and bought products from the high street,
Yes.
they can run the risk of having their teeth...
Extreme sensitivity.
Extreme sensitivity,
And patchiness, and unfortunately also they have very acidic, those products. They're not regulated sufficiently.
My teeth get quite sensitive when I have teeth whitening. I mean, can you sort of explain to me a little bit about, you know, what causes the sensitivity?
Just use desensitizing toothpaste for 2 weeks before you start whitening, and that will make a big difference during the whitening process. But the reason it's sensitive is the bleach gets right inside the nerve of the tooth within 15 minutes, and then it travels out again, and that pathway is why it's sensitive.
Well, Linda, doesn't look like I'm going to be taking these products away.
Absolutely not.
You're not going to let me?
Absolutely not. The best person to go to have your whitening is the dentist.
Go to the dentist.
Now men start to use an increased amount of skincare products, and they're not shy anymore to decide to have some Botox and occasionally some fillers, mainly from the nasolabial folds, to improve the way they look. There's also another trend which has probably started in Germany, but again is moved into the northwest quickly now, which is a non-surgical rhinoplasty. You can first of all gently reshape the nose just with saline and local anesthetic, and you can do a non-surgical rhinoplasty within half an hour with fillers. And the result with the good filler tend to be quite long lasting, up to 1 year. I have patients as young as 38 to 40, if you like, late 30 and early 40s, who come for a non-surgical rejuvenation, and then you can help them with fillers in the malar area to increase the cheekbone, to improve slightly the cosmetic of the nose, to slim the face and give a more defined lower face, a triangulation with some Botox jaw reduction. The moment this is not enough anymore, then obviously you can have other procedures like the eye guide, or something that I do which is called scarless facelift, where you decide according to the hairline of the patient, the hairstyle of the patient, the lifestyle of the patient, where you want to hide the scars. The patients who wanted to look fresh and didn't mind the stigma of a facelift, I would probably say is a patient of the past. Now patients are very well informed, they do a lot of research, which is never a bad thing, so they come to you knowing what on average is available. Then I think it's up to the professional, and that's the reason why I spend so much time with my patients, is to guide them in their trip, to try to identify their needs, and then to try to offer them the right procedure.
When a new client comes in to see me, I like them to see me as a person they can relate to. I like to find out what it is that they really want to achieve. I'm looking at their face to see how it's moving and thinking about what I want to do for them. Just create something individual. What I do different here is that I create my own little new techniques that you won't have seen anywhere else. And for instance, most people usually only have Botox in the upper face, but I'm developing some amazing little results for Botoxing the lower part of the face. The whole ethos behind my treatments is I'd like to see that person feels better about themselves, that they still keep their personality but it's tweaked, it still looks natural, they look fresher, they come out and feel much better about themselves.
Beauty is, a little part is skin deep, definitely what parents' genes gave us. but a big part is how the patient feels inside. If they're confident with themselves, if they're happy with their lives, if they think they're great, they're looking great. Our job here at ANSA is to offer the patient all kind of, even little treatment. It doesn't have to be invasive like surgeries. Little treatments can change something in their face, in their looks, and give them great confidence. I think a lot of people are not happy with the look of their skin. You know, an aging skin, a sun-damaged skin can make them look very tired and not happy. What we do is, for example, a Fraxel treatment which refreshes the skin, make them glowing and shiny. And starting with this treatment, which takes only maybe 30 minutes, the walk-in procedure, can change a big thing for the patient. The result's going to be seen after a week already. Maybe we do a repeated treatment, 2 sessions, 3 sessions, but it's such a different look afterwards. We give them 10 years back sometimes, so they're going to be so self-confident, they're going to be shiny and glowing, and they're happy and confident. That's all we can do for them.
I'm here with Natasha Broom from America, who's going to give me some insight into what some of the consumers here think about beauty and fashion.
This is exciting atmosphere here today, Steve. We're going to go find out all the tips of the trade and the secrets that these girls are doing to make themselves look beautiful.
Right, I think you go that way,
and
I'll go this way.
Yes. See ya. So are you looking for the new face for Perfect C?
Yes, we feel it's important to get a new face for the product, and obviously coming to a show like this is giving a lot of girls an opportunity. Perfect C is a great alternative to having surgery, and many girls, as you know, don't want to go under the knife, but they're looking for a natural alternative. Let's say, personally, I think a lot of girls go under the knife for the wrong reason, and you know, if they can try Perfect C and they get a result, that's great. I'm really happy for them. We know worldwide lots of girls come in writing saying they've had great results over a 3 to 6 month period, and I think that's what it's all about.
What made you sort of think about actually entering in this competition?
Well, I've obviously watched the show and I've always admired the girls on it, so I thought, oh, I just want to try it for myself.
Are you influenced a lot by the media these days?
Yeah, definitely. Looking on the covers of the magazines, the girls are always really, really beautiful, and everyone really wants to look like them.
It's been really fun. I mean, I love walking along the catwalk, so it was good just to get out there and just experience it.
And now tell me, do you follow a beauty regime? How old are you?
I'm 18 years old, and of course I have to care for my skin. My mum has already taught me to cleanse, tone, moisturize. Take off your makeup before going to bed, yeah.
I use like moisturizer and cleanser and toner, but that's about it.
And at what age did you start following a normal beauty routine?
23, I think.
So recently?
Very recently, yeah. When I was 16 and 17, there wasn't any of the... I think there's a lot more pressure nowadays on people, a lot more, so...
And what you put in your body too is important.
Absolutely. Well, I'm very health conscious, vegetarian, have been since birth. Loads of water, loads of vitamin tablets, minerals, green tea. I'm very health conscious to make sure that, you know, we're well in the future.
Would you ever consider plastic surgery?
Would I? I would actually, at a point in later years, absolutely would.
Well, it has been a great day at Britain and Ireland's Next Top Model Live. Have you had a good time?
Oh my gosh, it's been fantastic. We have seen so many amazing things, everything down to skin treatments, gorgeous models, girls that want to be models, fashion shows, exciting new products out on the market.
And I've rediscovered my love of the catwalk. So there you go. But I thoroughly enjoyed seeing some of the girls gain back their confidence and really strut their stuff on the catwalk. So what a great show.
It's been absolutely fantastic.
Well, that's it for the My Face, My Body series this year. I hope you've enjoyed us travelling all over the UK to bring you the best kept beauty secrets. But next year, we'll be travelling abroad to bring you the very latest cosmetic and beauty solutions. So stay tuned.
This programme, produced and funded by MyFaceMyBody, was also partly funded by ND Med Pro, Glow Minerals, Zoom and iGuide.